I'm Dr. Jason Billette, bariatric surgeon at Memorial Hermann The Woodlands Medical Center here in the Woodlands, Texas. So I do general surgery and weight loss surgery. One of our main focus is indeed weight loss surgery or bariatric surgery. And so what we do is we have patients come in that are considering, exploring weight loss both from a surgical and a non-surgical standpoint. When you look at criteria for bariatric surgery, there's a lot of factors involved. As an example, if somebody has type 2 diabetes or high blood pressure, sleep apnea, a variety of medical problems, then the criteria for weight loss surgery will shift because of that. But typically what we look for, people with BMIs above 30, 35, or BMI above 40. The BMI is a body mass index. It's a ratio of height and weight that gives us a number that we use in terms of calculations.
So it was probably about 2022. I was my heaviest at 375. I did all of the yo-yo diets, Atkins, all of that stuff. Nothing was really working. Came to see Dr. Billette once, and my insurance wasn't approved. It was going to be a lot of money out of pocket. So we chose not to do it. Still tried to do the yo-yo diets back and forth. Tried to do it a second time when the insurance plan got changed, was still denied. No fault of his, but purely insurance. And then I was able to get on my husband's insurance. And third time was a charm, and my insurance actually approved it before it ever went to my husband's insurance. So it was the same insurance, but they took 3 years to approve it. So still a lot of up and downs. I did start GLP-1 about a year before my surgery date with Dr. Billette, and that was a lot. It was very hard. It made me very sick. Lost a lot of hair. My emotions and my energy were all over the place. There were days that I was fine. There were days that I could barely get out of bed. It just depended on where I was at in the week with my shot. Then I was able to finally get approved with insurance and had the surgery, and it's been an amazing experience. I've had no negative side effects. I've kept the weight off. It's steadily dropping. I'm off of almost all of my meds except for one, so it's been an amazing experience.
I think most people today have exposure and experience to the weight loss medications. And those medications, they have their role and they work certainly in certain circumstances. And there are times when patients will take those medications, they will exhaust those medications for the effectiveness for that particular patient. And then those patients will come over to us and consider surgery and surgical procedures. And so I think the incorporation of surgery and GLP-1s and how that all fits together, that's a moving target. I think that's where you individualize your care from patient to patient. And I think one of the important things when it comes to weight loss and or weight loss surgery is trying to get involved in a system where you have multiple options and we can incorporate those options together. It's not unusual for us to have a patient prior to surgery be on GLP-1s. It's not unusual for us after surgery, say 12 months or 18 months down the road, to jump on a GLP-1 to pull somebody off of a stall. So I think it's the incorporation of all modalities to try to achieve success in that individual patient.
I have PCOS, and I recently was, like right before I had surgery, was diagnosed with lupus. So just not taking care of myself, for one, which is a big part of it, but also having the other medical factors included in that made it really hard for me to lose weight. So it didn't matter if I took, the weight loss pills that were either over the counter or prescribed by my doctor at the time. It didn't matter what fad diet I tried. I was working out every day sometimes, and then I would get discouraged and I would go months and not go to the gym because I wasn't seeing a difference. Like, it was a yo-yo of emotions, and it was just really hard during that time. After I had been on GLP-1 for a year, we changed the type of GLP-1 that I was on, and I did lose weight while I was on GLP-1, but I stalled. And then we changed, it made me very sick, so we went back to the original and I wasn't losing weight. So at that point, even though I was watching what I was eating, I was exercising on a regular basis, like I was truly committed to like taking care of myself, I wasn't seeing a difference. And that's when I went back to Dr. Willett and was like, okay, let's see if we can get it approved through the insurance. And thankfully we did, and it's been amazing since.
For bariatric surgery, what we do is we bring patients in and we explore multiple options. When it comes to surgery, we typically will go over gastric bypass, gastric sleeves. Those are probably the main two. In addition to that, there's a procedure called a SATI, and other procedures that have historically been done aren't done so much anymore. Like a lap band, it's not really done that much anymore and doesn't have the popularity that the gastric sleeve and the gastric bypass do. Well, I think the gastric sleeve is still the most popular, and then the gastric bypass is the second most popular. With the gastric sleeve, what we do is we surgically reshape the stomach and create the sleeve out of the stomach that a person has. With the gastric bypass, what we do is we create a small pouch, usually at the top part of the stomach, and then bypass the intestines to that pouch. When we perform surgery, we want a patient to be committed, not just to the surgery itself, but to lifestyle changes. And I think in the ideal circumstance, it's diet, exercise, and surgery. It's putting those together properly is when we see the best results. But we certainly want people committed to a lifestyle change, and we want the surgeries to be effective throughout.
Surgery day, of course, was scary. You never know what to expect because everybody's body reacts differently. I did stay overnight one night. The pain wasn't unbearable. It was uncomfortable, but it wasn't terrible. I mean, they send you home with everything that you need, and I think I was only on pain pills for maybe 1 or 2 days after surgery, but just following his instructions and being up and walking and being active really helped a lot with that. So, I mean, just knowing that I could pick up the phone and call his office and get help or guidance whenever I needed it was a big, big thing for me. Life now on the other side, it's been fun, actually. You don't realize how much your life is affected by being overweight. You don't realize how much your life is affected by even just the other things that are incorporated with that, like the PCOS and the lupus. You don't understand how all of it comes together until you actually have a chance to go back and look at the bigger picture. So, you know, I started my real estate journey, and I've seen a huge amount of confidence since I had my surgery. I feel like I can, you know, put myself out there a lot more. I can keep up with my bonus daughter. I, you know, do things that I never thought that I would be able to do. And it's not just the on-scale victories. It's not necessarily about the number for me. But if I go to a clothing store now, I don't have to shop in the plus size clothing. And I sometimes forget that because I'll automatically go to that section and I'll pick out what I used to wear. And then I'm like, oh, wait. So then I have to go get a smaller size, but then that is still too big for me. So then I'm constantly learning, you know, where I'm at clothing wise, you know, fitting into places that I never thought that I would fit into, not having to have seatbelt extenders or, you know, things like that. Those are all big wins for me, even though it's not on the scale. I have more energy. I'm a lot more active on a daily basis. We really watch what we eat as a family now. It's not just eating out every night and, you know, feeling miserable the next day, because with the surgery, you really have to be conscientious of what you're putting in your body, because it's a tool. It's not a miracle. Like if you don't take the right steps and do what you need to do, it's not going to work. But it also, my taste buds have changed, and I'm liking things that I never liked before. So a lot of the vegetables that I hated, or I thought that I hated when I was bigger, I love now. And so we incorporate those a lot more. And so it's not just a lifestyle change for me, it's a lifestyle change for my family, because I'm able to be healthy with them and be active with them. So it's not just about me, it's about everybody in my family.
So we first met each other in my office, and we had a great discussion about weight loss options. We talked about what you were currently doing, and looking for avenues and options to try to take it to the next level. And through those discussions, we talked about the insurance requirements. We talked about the surgical procedures and which one best fits. And then we talked about medications that she historically has taken. And we tried to put together a plan that fit what you were looking for.
Yes.
And so we put that together, and then through that process, we started to execute that plan. We went through the prerequisites for the insurance company, and then we started to prepare for our surgical procedure.
With my particular insurance, we, had to do monthly check-ins. We had to, make sure everything was going good. So we would go to the office every month. I would see, Dr. Paulette or one of his associates, and just make sure everything was where it was supposed to be, where it needed to be. And then, of course, going through all the lab work and making sure everything with me was okay before surgery. And then we were able to schedule surgery.
And then we met up that surgical day in the hospital.
Mm-hmm.
Another anxiety-provoking moment is the surgical day. And so we understand that anxiety and emotions are high on that surgical day. And so one of the things that's important to do is to recognize that and just make sure everybody, not just the patient, but the support staff that's there for the day of surgery, understands what we're going to do. We also incorporate our anesthesia colleagues to come in, and we have dedicated anesthesia colleagues that help us with our particular surgeries. And so they too come in and talk before surgery and make sure that not just the patient, but the family members are all on the same page.
Correct. So surgery day, they made me, like, I was scared because you never know what to expect. Everybody made me feel welcome. My husband was there with me. He knew exactly what was going to go on, how long it should take, and everybody kept him informed, and the aftercare was amazing, and I'm glad that I was able to finally get approved to get it done.
So then after the surgery, what we do is put people into the hospital for overnight. And here at Memorial Hermann The Woodlands, we have a dedicated nurse navigator. And so we have a person that guides the process, that oversees the nursing staff on the floor, make sure that all the pieces of the puzzle for education are in place. And so having that nurse navigator work the patients through the hospital system certainly adds comfort on both sides, not just with the patient, but also the treating physicians. It puts that link together so that we're all on the same page with education, with surgery, with recovery, and then all the important aspects that we're trying to hit, particularly with the first few weeks out from surgery.
Correct. Yeah, the coordinator was amazing. She was there from the beginning, and she was there after surgery, and even after I left the hospital, she was in contact. So it was a very supportive process.
For most of the surgical procedures, what we do is bring the patient in, perform the surgery the day they arrive, and then we go through a stage of recovery. That's just to clear anesthesia medications and make sure that the process of having the surgery has improved. And then we put the patients on the hospital floor. Typically what we see is an overnight stay and then home the following morning. So in and out of the hospital is pretty straightforward. It's not a drawn-out, lengthy process like it has historically been. And I think in your particular case, it followed that same pathway.
It did. I went in the morning, and I think I was in surgery by 10, and I left the very first thing the next morning. So it was very in and out.
And getting home, getting back in your own bed, familiar surroundings was...
It was nice to be
nice.
in my own bed. I mean, nobody wants to stay in the hospital. So just a few hours overnight just to make sure everything was good, your pain is good. Like it was nice to be home, but yes, it was very quick. I've always been heavy set as far as I can remember. But when I started getting to the point where I was really unhappy, that's when I would do endless doom scrolls on TikTok looking for, the weight loss pills or the gadgets that you can stand on and miraculously, lose weight, or, what other people were doing, what fad diets were out there. So it was years of just online Google doctor, Dr. Me trying to figure it out, but I really knew nothing. And it wasn't until I actually got with the doctors and figured out where my problem lied, what other health issues contributed to that, and was able to find a team that was able to kind of put them all together and put all the pieces of the puzzle together to make it work. So, I mean, that's my advice for anyone. I mean, you can doom scroll all you want, but until you're actually ready to take that step and be committed and like work with a team, do what you need to do, as well as, be able to depend on the team that you've chosen to help you through that journey, you got to do what you got to do. But making that choice is not easy, but it's hard and it's worth it.
Yeah, as a surgeon that sees lots of patients that do get on the internet and do their own research, it's certainly important. Having the access to that wealth of information is extremely important. Sometimes you can get down into a rabbit hole where you're probably not in the best of locations, but there's so much good information out there that it really allows the patients to have a decent foundation and understanding, so that when they come into the office and talk to one of us or one of our providers, that we have great discussions. We can really advance where we're headed with that particular treatment plan. So I think the amount of time that somebody spends on the computer, on the internet, searching, it certainly can be overwhelming, but there is value to it. There is value, and it's value that, as we discuss in the office, it allows us to sort of choose our pathway.
Yeah.
It allows that fundamental basis of what we're trying to do to be there so that we can build on it.
I think it also helps kind of rid some of what's really true and what's not.
Right. There's a lot of false information out there,
is.
but there's some really good stuff. And so it's trying to work through that together to get where we want to be.
Yeah, for sure.
I think it's important to be involved in a multidisciplinary weight loss center. Having access to multi-specialties, to registered dietitian, to the psychology team, nurse practitioners, I think that puts you in a situation where you can cover all your bases. Merely getting a GLP-1 on a website and trying to chase that by yourself, it's certainly doable, but it becomes a tough way to make it all come together. Having a team approach tends to work better. I think when it comes to weight loss, in terms of trying to get access or avenues into care, we typically have people come directly into our clinic. Sometimes we have referrals from primary care physicians, but most time we have patients that come directly in, and we can navigate that patient through surgery or non-surgical weight loss means. Being overweight and trying to figure out the pathway out of that is clearly overwhelming, and we understand that. It's easy to get lost in the shuffle on the internet, reading the newspaper, or even watching the TV on what you should do. Part of the process is unbundling all that, not just from a procedural standpoint, but from a mental standpoint. And we think the best approach to that is to come into the office, meet with the provider. And there you'll start to break things down and organize what pathway, and then you start to achieve that pathway slowly thereafter.
I would tell them that they're not alone, for one. There's a plethora of people out there, whether it be Dr. Paulette or whoever, they are working with. Like my story, I tried 3 times to get approved after doing GLP-1 and seeing multiple doctors and doing the yo-yo diets and feeling discouraged and giving up. And then, New Year's resolutions come along and I'm going to do it again. And then 3 months into it, I'm not seeing the results that I thought I should see. So I just give up and go back to my old habits. And it's definitely a lifestyle change. So you have to be not only mentally prepared for it, but you have to be, committed to doing it. But it's hard, but it's worth it. And, there's a lot of support groups out there. There's a lot of people that will cheer you on, and you don't have to do it by yourself.